right and to the left. So I just want to see how much you're pulling on each area. So go ahead. Okay, so do you feel more tight on this side or on this side?
I don't know. Like it's
It
just
doesn't.
kind of the same.
Is it achy or sharp?
It's just, I guess it's typical achiness.
Okay, go ahead and
Like
relax
comes
now.
up all the time because I feel like so strained.
Do you feel, is it kind of through here on the side? Because you said up on the neck, or do you feel like it comes up on the neck?
I feel like it from all the way here, all the way down.
Okay, so we're following all the way to this point, all the way up like that. Okay, so go ahead then and right ear to right shoulder, and okay, and then now lift up this shoulder. And do you feel that down here, or do you feel a pull up here when you do that? Or is it just kind of sore throughout?
It's all kind
all
of
the
sore
same?
through. It just all feels like it's one big knot that's like strained.
You're definitely, I feel like there's definitely more tension on this side.
Probably.
And then take your left ear, and then do you feel this pull through right through there?
I feel it more here.
Okay,
and
when you
it
pull down.
wraps around
Okay.
my shoulder blade. I got in a car crash.
So through here.
Yeah.
So this is where I feel like
Yeah, it's
probably
right.
most of your tension
Yeah.
is right through there. And then kind of, yeah, right up through here. So would you say that it's just kind of following this pathway?
Yeah, it feels like a pathway.
And then it's really posterior here.
Yeah.
So
yeah,
less here, it's
yeah,
more here.
Yeah, it's more like.
Okay.
Yeah.
The other side?
Yeah.
So kind of here.
Yeah.
Down.
This side might be tighter.
Yeah.
I have knots there. So this feels like it's kind of off.
Yeah.
Yeah, that's
Yeah, this is
mine
where I
right
feel,
there,
yep.
that's where the tension is.
Yep, I can feel that. Yeah, definitely right there.
Mm-hmm.
Okay, so then if we move anterior, do you have any pain?
Yeah, right
It's
here
right
I
through there.
feel a little bit of like.
So go ahead and reach up with your shoulders and then feel back with your hands, and I want you to feel if there's any area outside of right here and right here that you feel that tension. You can think of like when you're sitting or working or driving where it
It's
pulls
just like
from.
back
It's
here.
back there. Yeah.
Yeah.
Okay, so that's where it's pulling from, is back here.
Yeah, it kind of like goes and then all the way around like that. You know that area.
Yeah.
Like back. Yeah, it's like it's messed up.
Yeah. So we want to be most specific with our injection where most of your tension is, right? Because otherwise it's like, okay, well, we could put 200 units in, but one, it's so expensive, you know?
Yeah.
And it eventually wears off. So part of making this really effective is also doing other things. Do you do like heating pads or?
I do like sauna.
Okay, and do you do like, have you ever used like a massage gun?
Yeah, I try to use those.
Where you're most tight with it most concentrated, and then kind of phase it out. Because I think if I can get where you're most constricted, it will help to relax. I don't know that this is going to be like a one-time thing, so it might be good to see you back in a couple of weeks and you know, feel around where, you know, where is it really relaxed, and you know, maybe make a plan for one, maybe two more. I think if we can get everything just to totally relax, then your massage gun or heating pads will just help the muscles kind of relax even more.
Right.
And I know your mama talked about doing some stripping.
Yeah.
So we don't do that just because I'm not a massage therapist.
My uncle is a chiropractor.
So he knew, even for the first month, just heat, nothing else. If any massage, just very, very gentle massage, and then just kind of see how you respond to that. And if you start to feel like, oh yeah, this is relaxing, just kind of maybe keep doing that. And then we'll go from there.
Yes.
So. Okay. And then I can, this typically isn't a really painful procedure. I mean, maybe a little uncomfortable.
Okay.
I can mix it with some lidocaine so that will help too.
I mean, how many needles are we are we looking at?
Well, I don't know, and because we'll just kind of spread it throughout. But it really, it's not that bad.
Is it like 15?
Probably around that many. Yeah. And then what we'll do too is we'll just use ice, and I think you'll find, especially on our back, like our sensation is different. And we like to use arnica gel, which is really calming. So I think you'll find that it's like not that big of a deal. I know sometimes people think like, oh God, it's gonna be horrible, but it's nothing like when people are getting like injections into their joints and different things. That's nothing like.
How many units is that?
So you hyper dilute. This would be something good to do a little video on too. But we hyper dilute for Trap Tox so that you actually want more spread.
Oh, okay.
Instead of same with under the arm. So I do 3 mLs of saline, 1 of lidocaine, and 1 of bicarb.
And that causes it to spread more?
Yeah, because the saline is just a diluent. So imagine if we just injected powder, it wouldn't go anywhere.
Yeah.
You actually wouldn't be able to inject it. So the more fluid you put in, the wider range. Just poke here, hon.
Okay.
How's that?
Oh, that's fine.
I've seen some of those videos on TikTok or different things where people do that. It's crazy. You doing okay?
Yeah, I'm fine. I've been through worse. It just kind of feels like you're popping a big pimple. That's what it sounds like too.
It does, because you can feel it going through your skin, huh?
Okay.
And kind of hear it probably. Do one up here, one neck. I was like watching it. Here's another poke. It's like a surface tension or something. I don't know. But yeah. It takes a little bit longer in the muscles because you have so much tension in there. So it'll take some time for these to relax, but you'll definitely notice it. Probably you'll start noticing it after like 10 days. It takes a minute, and then it'll just get better and better. And then I would either have you come back, or we can just do a quick phone call in like a month or 6 weeks. But I would definitely recommend at least one more treatment at about 10 weeks.
Okay.
So right when that muscle tension is wanting to come back, you treat it again, and then it really relaxes. And then sometimes you can even do like, once every 6 months, just kind of keep that tension from really building up, you know, really tight again. Here's a poke. I think that would really get you kind of back on the right path of just then being able to manage it, maybe just with massage and heat. Okay, we're done with injections. But yeah, I don't think I would recommend a really intense massage until, because like a lot of times they want to just kind of check in like at the 6-week mark or 4-week mark and see, or if you even want to come back in 4 weeks and we can kind of see, you know, what feels better. Because you know, we could also do a touch up then if you're like, oh, this area is completely relaxed, but over here I still have some tension, and that's an option too. So whatever feels best for you. Okay, you did great. It was really nice to meet you.